Hi, welcome back to the Truth Doctor Show. My name is Dr. Courtney Tracy. Thanks for coming back if you've been here before. And if this is your first time, I talk about the world through a mental health lens using pop culture and the media as my medium. Today, I am answering the question, should you self-diagnose? And the short answer is yes and no. There are risks that come along with self-diagnosis, and I'm going to talk about those first, but then I'm also going to talk about the benefits. There's three major risks when it comes to self-diagnosis, and this isn't coming from me being a mental health professional. This is me coming from the lens of being a client who has a therapist and also a client and a human being that suffers from mental health issues and has self-diagnosed herself in the past incorrectly and then actually self-diagnosed herself correctly. So let's start off with the first risk of self-diagnosing yourself using online information. The first thing is that you can experience unwarranted fear, worry, or panic. When we are experiencing certain symptoms of something and we go online to figure out what's going on with us, when we have a headache could be a symptom of a brain tumor, for example. Now, most people aren't going to go to that extreme, right? Saying, oh, I have a headache, therefore I have a brain tumor. But people can often diagnose themselves with something that's far more severe than what it is that they're actually experiencing.
Hi, I'm Dr. WebMD.
What is it, Doc?
You have cancer.
How could you possibly know that?
Oh, I tell everyone they have cancer. Why? What seems to be the problem?
So please be careful if you are going down the path of self-diagnosis for one reason or another, that you check in with yourself and make sure that you're not adding on any unwarranted fear, anxiety, or panic. The second biggest risk when it comes to self-diagnosing using online information is that there's a lot of misinformation online and a lot of unreliable resources. Since I started my platforms on social media, I have not only seen therapists put incorrect information out there to the public, but I've also seen people who have experienced mental health issues or who just want to share mental health information, not share the information in the best possible or most accurate way, or they're just sharing their personal stories, which I absolutely love. And they're sharing the tips and tools that help them through their stories, but they're not putting the disclaimer that this was specifically helpful for just them and encouraging people to continue to do their own research as well. So let's continue putting out our stories, and what helps, just reminding people that they need to look into what's personally going on for them and finding personal solutions as well. So look out for misinformation and unreliable resources. The most important risk, I would say, the most dangerous risk of self-diagnosing online is a two-part. First, it's not actually diagnosing yourself with what it is that you actually have so that you can actually get the treatment and the intervention that you need. But it could also be diagnosing yourself with something that you don't have and then actually moving forward with treatments that are inappropriate also.
Pretty hard to consume enough fish to give yourself mercury poisoning, and it doesn't usually present solely with pain.
But it can. Check out the Atlantic Medical Journal. This guy came in with burning pain caused by erythromelalgia caused by mercury poisoning.
Who needs actual doctors when you got the internet?
Well, no offense, but doctors make mistakes. Medical errors are up 30% this year.
You should check the rate of patient error.
The world of online information, medical or mental health, is continuing to grow. And there's a lot of reasons for that. So I think we should continue to use the internet to find accurate and reliable information that can help us learn about what's going on with ourselves.
There's a ton of information out there. Why wouldn't I educate myself, be my own advocate?
Here are the benefits to self-diagnosing yourself online, because there are benefits. The first benefit is that healthcare is expensive and it's very inaccessible. Medical healthcare, mental health healthcare, so many different types of healthcare. Sometimes people can't even get the medications nor afford the ones that they need. So they have to go the holistic route. They have to look things up online. They have to read books, blogs, join communities, and do the best that they can to start to heal themselves. Next, there's a reason that there's WebMD. There's a reason that there's symptom trackers online. It's important for us to be able to know when something is wrong, to even reach out to somebody to ask for help. If we don't self-diagnose ourselves, even to a degree that we think that there could be something wrong, then why would we ever reach out to a healthcare professional? Yes, maybe we do our annual checkups with our blood work, and maybe we have a therapist that we check in with once a year or once a quarter if we know that we've had something wrong in the past and we want to check in on it casually to make sure that we are still stable. But other times when we are experiencing a medical or a mental health issue, we go to the internet. it, we go, why does my head feel like this? Why is my arm numb? Why are my thoughts getting so negative? And is this depression or not? It's important that we have access to the information. And that's part of why I show up here the way that I do, because I didn't know anything about how my body worked or how my mind worked before I did 12 years of clinical education to get myself to the point of having a license and multiple degrees. Not everybody has the time or the money or the access to do that, nor should we have to do that in order to know how our mind and body work, in order to know when something is wrong. Also, sometimes we're going through things and they only last as long as until we actually have our appointment. This is part of it being so inaccessible. If we are struggling with our mental health and we can't get an appointment for 30 days and we go online and let's say we've been experiencing depressive symptoms for 2 weeks, which is the initial catalyst to get a diagnosis of depression. What if there isn't an appointment for you to see a provider for a month, for 3 months, for 6 months? We shouldn't have to sit there in our depression. We should feel confident enough to go and start to use some of the coping skills and learn about depression using the blogs and the things that we can find online. Also, it's really important, using the example that I had earlier, where if we are having a panic attack, for example, but we think that we are having a heart attack, and we go in and we learn that there are some symptoms of heart attacks that we're not experiencing, but we are experiencing all the symptoms of a panic attack, it can really help ease our worries and ease our panic and ease our anxiety. It's a catch-22. Yes, self-diagnosing using information online can bring you unwarranted anxiety, panic, and worry, but it can also alleviate unwarranted anxiety, panic, and worry. 10 years ago, Pew Research found that 1/3 of Americans went online to look at symptoms to see what was going on with them. That was 10 years ago. Well, almost 10 years ago in 2013. But just think about where we're at now. People use the internet more often. There's more information that's available. And honestly, through the pandemic, people are probably struggling more than they have been in the past. And they're probably using the internet now more than ever. So listen. Of course, the best course of action is going to be to find a provider, medical or mental health, that can actually hear about everything that you're going through, understand your symptoms, give you a label if you want a label so that you can go and move forward with certain treatments and interventions. That would be the ideal, but we know there are a lot of issues with healthcare and a lot of issues with healthcare providers having certain biases or being in generations where they don't quite understand certain aspects of both medical and mental health things that are going on for us today.
Rebecca, in my opinion, you've been misdiagnosed over the years. It's one of the main reasons you've been struggling. I think with the right diagnosis and treatment, you can get a lot better.
So please know it's okay to trust reliable sources. It's okay to trust information that you believe is actually informing you about what is going on with you. Thank you so much for watching this video. What do you think? Have you ever self-diagnosed before? Has it been accurate? Has it been inaccurate? Have you been more right than your providers in the past? What are your reasons for wanting to move forward with self-diagnosing online or absolutely being against it? I'd love to hear your thoughts. And as always, I am glad you exist.